Hi, my name is Young. My topic about is valent HPV vaccine against infection and intraepithelial neoplasia in women. Definitions. The nonavalent vaccine HPV-9 is the one that offers the greatest direct coverage against cervical cancer and provides potential preventions of 85 or 95% of vulvar, vaginal, and anal cancers related to the virus. The optimal time to start vaccination is before the start of sexual intercourse. The target population is preadolescents and adolescents, recommending 12 years as the optimal age for vaccination. Cervarix in its technical dataset has authorized the application of 2 doses between 9 and 14 years inclusive. Gardasil also 2 doses, but from 9 to 13 years inclusive, and Gardasil 9 is authorized to apply to those between 9 and 14 years inclusive. Unvaccinated 13 to 26 years old women are a high priority group for vaccination and can benefit from it, without the need for priority cytological or viral screening.
Cervical cancer can be prevented with a vaccine. Teens and young adults, both men and women, should get the HPV vaccine. From ages 21 to 65, women should get a Pap test every 3 years. After age 30, screening may include an HPV test. If both are negative, screening can be performed every 5 years instead. So get vaccinated and get tested.
Applications in nursing. Nursing is the professional of reference in vaccination campaigns, being in contact with both sick and healthy people. It has been said that it those autonomous communities in which the vaccination of this vaccine is carried out systematically is in school. The degree of coverage is very high, but in most communities, nursing plays a key role in any vaccination strategy. Since he is the professional who administers the vaccine and who, due to opportunistic uptake, can recommend it from primary care and in those areas of special care with greater contact with young women.
Affects many women every year. It is largely caused by the human papillomavirus. However, unlike many other forms of cancer, cervical cancer can be prevented by HPV vaccination or when identified early through regular cervical cancer screening. HPV is a virus that infects many parts of the body. There are many different subtypes of HPV, grouped into high-risk types and low-risk types. 70% of cervical cancer and precancerous cervical lesions are caused by the common high-risk HPV subtypes 16 and 18. In most women, an HPV infection shows no symptoms and does not cause any harm. However, in a small percentage of women, an HPV infection might cause the formation of abnormal cells on cervical tissues. This can develop into cervical cancer if left unchecked over time. Recent studies have shown significant reductions in cervical cancer rates in women who have undergone the HPV vaccination that target the HPV subtype 16 and 18. Results have been proven to be more effective when women are vaccinated at a younger age. The HPV vaccination is safe and is recommended for all girls aged 9 to 26 years old. Possible side effects are generally mild, such as soreness at the site of injection, fever, and headache. If you encounter any of these side effects, please inform your doctor immediately. If you'd like to find out more for yourself or a loved one about HPV vaccination, please contact the Singapore Cancer Society, your family GP, or the polyclinics.
Pros and cons. Pros. Quadrivalent vaccine protects against SARS-CoV-2 produced by human papillomavirus. By cross protection also protects against the same injuries caused by other types of high-risk human papillomavirus. The bivalent vaccine protects against SARS-CoV-2 produced by human papillomavirus.
HPV vaccination. What are the available vaccines? What is the mechanism of action of these vaccines, and what is the efficacy? How they are to be used, what dose and what is their safety, and future developments related to the vaccine. I'll begin with this slide, which shows you the age standardized incidence rates for cervical cancer, and you can see that globally there are 528,000 new cases per year, and in India there are 122,800 new cases, showing that 23% of the global burden is in India, and it tells us that India is in a very high risk area for cervical cancer. High risk human papillomavirus infection are responsible for 99.7% of cervical cancers. Other cancers also have been associated with HPV subtypes. 88% of anal cancers, male and female, are linked to HPV, 70% of vaginal cancers, 45% of vulval cancers, 50% of penile cancers, and 30% of oropharyngeal cancers are all related to high-risk HPV subtypes. 90% of genital warts in young boys and girls are caused by HPV 6 and 11, and it's very important to know that HPV 6 and 11 are the low risk subtypes. They are not associated with cervical cancer, but they are associated with genital warts. Now, which are the available vaccines available to us? Globally, there are 3 vaccines available. We have the bivalent vaccine, which targets the HPV type 16 and 18. We have the quadrivalent vaccine, which targets 16, 18, 6 and 11. And we have now the new vaccine, which is the nonavalent vaccine or the 9-valent vaccine, which is not a
Cons. Loss of efficacy of the vaccine by breaking of the whole network of conservation and management. It can easily happen in the office if you don't have the right refrigerator. Application defects that interfere with the efficacy of the vaccine if it is allowed to be administered by unqualified personnel. The injection must be intramuscular. Issue appeared in Ecuador. In Ecuador, during 2012, in Ecuador during 2012, 664 women died from cervical cancer, and the estimated insights in Ecuador for 2013 was 16 calls per 100 inhabitants, according to the SOCA, Quito Nacional Tumor Registry.
I'm seeing more and more families appreciate the importance of getting that HPV shot early. What I'm talking to both my male and female patients about and their parents is that, first of all, if You need 2 shots for HPV to be fully protected when you're under 15. So we're really looking for those 11 and 12-year-old kids to be getting protected now. Getting this shot for both males and females helps to protect your ability to have a family later when you want one. So it's a really important piece. It protects you from cancer, but one of the consequences of these cancers often are to impair someone's ability to have a family when they're ready. Most frequently, you don't know you have it. And it's something that you can get from having relationships, sexual relationships, and yet it then can stay dormant and sit there and wait. Eventually, it can put you at risk of having cancers. The wonderful thing is this is one of the few forms of cancer that we know the treatment and cure, and the cure is to prevent it. Go to your pediatrician and talk with your pediatrician so you understand the benefits. These are very safe vaccines. There have really been, practically no side effects. So it just benefits you.
Conclusion. Despite their high effectiveness rates, women vaccinated might develop cervical cancer due to vaccination failure, or because it is produced by a human papillomavirus from high risk against which no protection was offered. The need for screening even among vaccinated women is essential. Thank you.
The immune system protects us against germs that can make us unwell. It makes special blood cells and antibodies which help to do this. The first time your body meets a new germ, your body may not be very good at fighting it. That's because it takes time to make the blood cells and antibodies required to fight off the new germ. It's during this time that the germs can sometimes make you unwell. But a healthy immune system will eventually make the blood cells and antibodies that fight off the germs. Once your immune system has encountered a germ, it doesn't forget. The next time the same germ enters your body, your immune system is able to respond more quickly, destroying the germs before you become unwell. This is called immunity, and that's what the immunization is all about. HPV immunization works by making your body remember the most common kinds of HPV that can cause cervical cancer and genital warts. The HPV vaccine contains little particles that look the same as some of the particles on the outside of the real virus. Because they are only particles, not the actual virus, you can't get HPV from having the injections. They'll just trigger your immune system so you can fight the HPV virus if you need to in the future.